strain samples isolated from both outbreaks were renamed Ebola virus after the Ebola River, near the first identified viral outbreak site in Zaire. 35. Reports conflict about who initially coined the name, either Carl Johnson of the American CDC team, 170, or Belgian researchers. 171. Subsequently, a number of other cases were reported, almost all centered on the Yambuku Mission Hospital or close contacts of another case. 160, in all, 318 cases and 280 deaths, an 88% fatality rate, occurred in Zaire. 172. Although the two outbreaks were at first believed connected, scientists later realized that they were caused by two distinct Ebola viruses, SUT and Ebola. 159, 1995-2014. The second major outbreak occurred in Zaire, now the Democratic Republic of the Congo, DRC, in 1995, affecting 315 and killing 254. 1. In 2000, Uganda had an outbreak infecting 425 and killing 224. In this case, the Sudan virus was found told the Ebola species responsible for the outbreak. 1. In 2003, an outbreak in the DRC infected 143 and killed 128, a 90% death rate, the highest of a genus Ebola virus outbreak to date. 173. In 2004, a Russian scientist died from Ebola after sticking herself with an infected needle. 174. Cases of Ebola fever in Africa since 1976. Between April and August 2007, a fever epidemic, 175, in a 4-village region, 176, of the DRC was confirmed in September to have been cases of Ebola. 177, Many people who attended the recent funeral of a local villager Kiev died. 176. The 2007 outbreak eventually infected 264 individuals and killed 187. 1. On the 30th of November, 2007, the Uganda Ministry of Health confirmed an outbreak of Ebola in the Bundabugyo district in western Uganda. After confirming samples tested by the United States National Reference Laboratories and the Centers for Disease Control, the World Health Organization, WHO, confirmed the presence of a new species of genus Ebola virus, which was tentatively named Bundabugyo. 178. The WHO reported 149 cases of this new strain and 37 of those led to deaths. 1. The WHO confirmed 2 small outbreaks in Uganda in 2012, both caused by the Sudan variant. The first outbreak affected 7 people, killing 4, and the second affected 24, killing 17. 1. On the 17th of August, 2012, the Ministry of Health of the DRC reported an outbreak of the Ebola Bundabugyo variant, 179, in the eastern region. 180, 181, other than its discovery in 2007. This was the only time that this variant has been identified as responsible for an outbreak. The WHO revealed that the virus had sickened 57 people and killed 29. The probable cause of the outbreak was tainted bushmeat hunted by local villagers round the towns of Isiro and Viadana. 1. 182. In 2014, an outbreak occurred in the DRC. Genome sequencing showed that this outbreak was not related to the 2014-15 West Africa Ebola virus outbreak, but was the same Ebola species, the Zaire species. 183. It began in August 2014, and was declared over in November with 66 cases and 49 deaths. 184. This was 7th outbreak in the DRC. 3 of which occurred during the period when the country was known as Zaire. 185, 2013-2016 West Africa. Cases and deaths from April 2014 to July 2015 during the 2013-2015 outbreak in March 2014. The World Health Organization, WHO, reported a major Ebola outbreak in Guinea, a West African nation. 186. Researchers traced the outbreak to a 1-year-old child who died in December 2013. 187, 188. The disease rapidly spread to the neighboring countries of Liberia and Sierra Leone. It was the largest Ebola outbreak ever documented, and first recorded in the region. 186. On the 8th of August 2014, the WHO declared the epidemic an international public health emergency. Urging the world to offer aid to the affected regions, its Director General said, countries affected to date simply do not have the capacity to manage an outbreak of this size and complexity on their own. I urge the international community to provide this support on the most urgent basis possible. 189. By mid-August 2014, Doctors Without Borders reported the situation in Liberia's capital, Monrovia, was catastrophic and deteriorating daily. They reported that fears of Ebola among staff members and patients had shut down much of the city's health system, leaving many people without medical treatment for other conditions. 190. In a the 26th of September statement, WHO said the Ebola epidemic ravaging parts of West Africa is the most severe acute public health emergency seen in modern times. Never before in recorded history has a biosafety level 4 pathogen infected so many people so quickly, over such a broad geographical area, for so long. 191. Intense contact tracing and strict isolation largely prevented further spread of the disease in the countries that had imported cases. It caused significant mortality, with a considerable case fatality rate. 192, 193, 194. Note 1. By the end of the epidemic, 28,616 people had been infected. Of these, 11,310 had died, for a case fatality rate of 40%. 195. As of the 8th of May, 2016, 28,646 suspected cases and 11,323 deaths were reported. Winking sad smiley 15. 196. However, the WHO said that these numbers may be underestimated. 197. Because they work closely with the body fluids of infected patients, healthcare workers were especially vulnerable to infection. In August 2014, the WHO reported that 10% of the dead were healthcare workers. 198. 2014 Ebola virus epidemic in West Africa. In September 2014, it was estimated that the country's capacity for treating Ebola patients was insufficient, with equivalent of 2,122 beds. By December there were a sufficient number of beds to treat and isolate all reported Ebola cases, although the uneven distribution of cases was causing serious shortfalls in some areas. 199. On 28 January 2015, the WHO reported that for the first time since the week ending the 29th of June, 2014, there had been fewer than 100 new confirmed cases reported in a week in the 3 most affected countries. The response to the epidemic then moved to a second phase, as the focus shifted from slowing transmission to ending the epidemic. 200. On the 8th of April, 2015, the WHO reported only 30 confirmed cases, the lowest weekly total since the 3rd week of May 2014. 201. On the 29th of December, 2015, 42 days after the last person tested negative for a second time, Guinea was declared free of Ebola transmission. 202. At that time, a 90-day period of heightened surveillance was announced for that agency. This is the first time that all three countries, Guinea, Liberia and Sierra Leone, have stopped the original chains of transmission, the organization stated in a news release. 203. A new case was detected in Sierra Leone on the 14th of January 2016. 204. However, the outbreak was declared no longer an emergency on the 29th of March 2016. 18. 2014 spread outside West Africa. On the 19th of September, Eric Duncan flew from his native Liberia to Texas. 5 days later he began showing symptoms and visited a hospital but was sent home. His condition worsened and he returned to the hospital on the 28th of September, where he died on the 8th of October. Health officials confirmed a diagnosis of Ebola on 30 September, the first case in the United States. 205. In early October, Teresa Romero, a 44-year-old Spanish nurse, contracted Ebola after caring for a priest who had been repatriated from West Africa. This was the first transmission of the virus to occur outside Africa. 206. Romero tested negative for the disease on the 20th of October, suggesting that she may have recovered from Ebola infection. 207. On the 12th of October, the Centers for Disease Control and Prevention, CDC, confirmed that a nurse in Texas, Nina Pham, who had treated Duncan, tested positive for the Ebola virus, the first known case of transmission in the United States. 208. On the 15th of October, a second Texas healthcare worker who had treated Duncan was confirmed to have the virus. 77. 209. Both of these people recovered. 210. An unrelated case involved a doctor in New York City, who returned to the United States from Guinea after working with Médecins Sans Frontières and tested positive for Ebola on 23 October. 211. The person recovered and was discharged from Bellevue Hospital on 11 November. 210. On the 24th of December, 2014, a laboratory in Atlanta, Georgia reported that a technician had been exposed to Ebola. 212. On the 29th of December, 2014, Pauline Kafurki, a British nurse who had just returned to Glasgow from Sierra Leone, was diagnosed with Ebola at Glasgow's Gartnavel General Hospital. 213. After initial treatment in Glasgow, she was transferred by air to IF Northolt, then to the specialist high-level isolation unit at the Royal Free Hospital in London for longer-term treatment. 214. 2017 Democratic Republic of the Congo. On the 11th of May, 2017, the DRC Ministry of Public Health notified the WHO about an outbreak of Ebola. 4 people died, and 4 people survived. 5 of these 8 cases were laboratory confirmed. A total of 583 contacts were monitored. On the 2nd of July, 2017, the WHO declared the end of the outbreak. 215. 2018 Equator Province. On the 14th of May, 2018, the World Health Organization reported that the Democratic Republic of Congo reported 39 suspected, probable or confirmed cases of Ebola between the 4th of April and the 13th of May, including 19 deaths. 216. Some 393 people identified as contacts of Ebola patients were being followed up. The outbreak centered on the Bikoro, Iboko, and Wangata areas in Equator Province. 216, including in the large city of Mbandaka. The DRC Ministry of Public Health approved the use of an experimental vaccine. 217, 218, 219, on the 13th of May, 2018, WHO Director General Tedros Adhanom Ghebreyesus visited Bikoro. 220, reports emerged that maps of the area were inaccurate, not so much hampering medical providers as epidemiologists and officials trying to assess the outbreak and containment efforts. 221. The 2018 outbreak in the DRC was declared over on the 24th of July 2018. 22. 2018-2020 Kivu. On the 1st of August, 2018, the world's 10th Ebola outbreak was declared in North Kivu province of the Democratic Republic of the Congo. It was the first Ebola outbreak in a military conflict zone, with thousands of refugees in the area. 222, 223. By November 2018, nearly 200 Congolese had died of Ebola, about half of them from the city of Beni, where armed groups are fighting over the region's mineral wealth, impeding medical relief efforts. 224. By March 2019, this became the second largest Ebola outbreak ever recorded, with more than 1,000 cases and insecurity continuing to be the major resistance to providing an adequate response. 225, 226, as of 4 June 2019, the WHO reported 2,025 confirmed and probable cases with 1,357 deaths. 227. In June 2019, 2 people died of Ebola in neighboring Uganda. 228. In July 2019, an infected man traveled to Goma, home to more than 2 million people. 229. 1 week later, on the 17th of July 2019, the WHO declared the Ebola outbreak a global health emergency, the 5th time such a declaration has been made by the organization. 230. A government spokesman said that half of the Ebola cases are unidentified, and he added that the current outbreak could last up to 3 years. 231. On the 25th of June 2020, the second biggest EVD outbreak ever was declared over. 232, 2020 Equator Province. On the 1st of June 2020, the Congolese Health Ministry announced a new DRC outbreak of Ebola in Bandar Equator Province, a region along the Congo River. Genome sequencing suggests that this outbreak, the 11th outbreak since the virus was first discovered in the country in 1976, is unrelated to the one in North Kivu province or the previous outbreak in the same area in 2018. It was reported that 6 cases had been identified, 4 of the people had died. It is expected that more people will be identified as surveillance activities increase. 233. By the 15th of June, the case count had increased to 17 with 11 deaths, with more than 2,500 people having been vaccinated. 234. The 11th EVD outbreak was officially declared over on 19 November 2020. 235. By the time the Equator outbreak ended, it had 130 confirmed cases with 75 recoveries and 55 deaths. 2021. North Kivu. On the 7th of February 2021, the Congolese Health Ministry announced a new case of Ebola near Butembo, North Kivu, detected a day before. The case was a 42-year-old woman who had symptoms of Ebola in Biena on 1 February 2021. A few days after, she died in a hospital in Butembo. The WHO said that more than 70 people with contact with the woman had been tracked. 236. 237. On the 11th of February, 2021, another woman who had contact with the previous woman died in the same town, and the number of traced contacts increased to 100. 238.